Hi. Today's Friday chat. I'm going to discuss a little bit about coronavirus and what are some of the prevalent risk factors that they're finding in the science thus far. And I should preface all of this by saying the science is constantly changing as new data becomes available and new papers get published. But just doing a cursory review of some of the papers that have been published, there are some risk factors that are largely lifestyle factors that really make a person more susceptible to coronavirus. And I also want to say I completely understand that many of these things are beyond the scope of an individual's control. They're societal, they're a public health issue, they're about access to healthcare. There's a lot of factors that come into play: economics, race, and other social factors. So I don't want to suggest that the onus is completely on the individual, but there are things that individuals can do to improve their immunity and reduce their risk factors for coronavirus. So why not share those things? Um, Obviously, the number one risk factor that they're finding most frequently is age, and unfortunately, there's nothing you can do about your chronological age, but there is quite a bit you can do about your biological age, and that is how aged is your body. So, the main kind of lifestyle factors that impact that biological age and increase your risk factors that they're finding are obesity, particularly abdominal fat, and body mass indexes above 30. I think a more accurate measure is measuring your waist to hip ratio, and anything over 0.85 definitely puts you in the trending towards obesity size, and that's also showing that you have more abdominal fat, which is the more risky area to carry fat. For some reason, it increases inflammation and increases your risk for contracting coronavirus. Secondly is high blood pressure, otherwise known as hypertension. Third is type 2 diabetes or prediabetes. And fourth is heart disease. So, what can we do about those things? Well, some physicians and scientists are suggesting that we add more cardio to our workout routine than maybe we normally do to really increase oxygenation and blood flow, but also to improve our lung capacity. Also, add mini workouts through the day. This is especially important if you have a job where you sit all day. Just take little 5-minute breaks once an hour. Do some wall push-ups or some squats, or drop down and onto the floor and do some sit-ups and other exercises. Clean up your diet. Now, with most restaurants being closed or severely constrained, we're eating at home a lot more. So we really have an opportunity to really clean our diet up, to get the sodium down, to eat less carbs, to eat less hydrogenated oils, to really eat clean, eat grass-fed pastured meats, organic vegetables and fruits, whole raw nuts and seeds, clean organic dairy if your body can tolerate that, and really reduce your sugar consumption especially. Also, add more stress management. I know that's easier said than done. It's a very stressful time, but please watch my other video about coping with pandemic. It gives a lot of tips on how you can manage your stress more appropriately or effectively. But I would suggest maybe adding daily meditation or prayer as a good stress management tool, and focusing on really good sleep hygiene, going to bed at the same time, getting at least 7 or 8 hours of sleep, keeping your bedroom nice and cool, dark, no distractions, and really try to power down and get an excellent night's sleep. Also, hydrate a lot more, drink more water. And then really make sure you're getting enough vitamin D. I would suggest always supplementing, regardless of where you are on the planet and what color your skin tone is. I think that most humans are just not getting enough vitamin D, even if you're out in the sun all day. But in addition to taking a vitamin D supplement, also getting some real sunshine, not only will that help your skin produce some vitamin D naturally, but it's also been shown to improve melatonin production in the evenings so that you can fall asleep. So it really is effective for helping you maintain good circadian rhythms and getting sleepy at night and feeling awake in the morning. So those are just a few tips. I hope you can try to take advantage of this time, staying at home, being around family, recreating close to home, maybe not traveling as much, not commuting as much, and use that time to keep your health up and improve your immunity so that we can all stay healthy. All right. Thank you all.